Ready to move the clocks forward. Many people are concerned about losing that 1 hour of sleep. We're joined live in studio for more on this with KTVU Medical Expert Dr. Larry Burchett. Thank you, doctor, for coming in.
Good morning, guys. Thank you.
We're talking about 1 hour here. I mean, how big of a deal really is it?
I mean, you're not really losing it.
Like
You're not really losing it. You can choose not to lose it, right?
You can
if
choose
go to bed
not to lose
earlier.
Could go to bed earlier, sure. How big is an hour one night? Probably not that big of a deal.
Not about that. Now, that's what I thought, and then I saw this study from the University of Colorado at Boulder. I went there, so I was just cruising, and it popped up 3 years ago. It said there was an increase in fatal motor vehicle accidents the first 6 days after the clocks jumped forward.
Oh, interesting.
So then I got concerned. I'm like, well, maybe that 1 hour does mean something. Maybe people are a little bit sleepier, especially out there on the roadways.
You know, I guess the way that I think about that is most people are chronically sleep deprived. So to take 1 more hour away from them puts them at risk for driving and probably all kinds of related problems. Adequate sleep is associated with so many good things. Not only happiness and your health, increased mental function, better sex life. So not only are you, not tired, but your body releases testosterone at night, so your libido is up, weight loss, better immune, on and on and on.
Right.
All of these benefits of adequate
What is
sleep.
adequate sleep? 8 hours, 6 hours, 9 hours? Is it different for every person?
Yeah, we were just talking about that. So the answer to that is when you start to get tired and cranky, that's probably the answer to.
Yeah.
Late Wednesday, maybe
It is
Thursday
bedtime.
night, right?
Yeah, right. Like
Right.
for each person, that's how you answer that question. But studies show for most people, and you might not agree with me here, it's 8 or 9 hours per night.
That sounds like a luxury to
Doesn't
a lot
it?
of us. So let me ask you this. If Americans know the benefits of sleep, why do so many of us say, I can get by with 6 hours? I got 6 and I'm doing fine. Why do we rob ourselves of that precious sleep?
I got a life to live too, like it's not exciting and sexy to go to sleep early at
You feel like you're missing out on something.
Yeah, you feel like you're missing out on
Or
things.
poor planning, maybe?
That's another good answer. I think a lot of people too haven't tried, this is my challenge, for a week to get 8 hours of sleep and see how you feel. If you feel incredible and you're like, wow, this is something maybe I'm gonna do more often. Or maybe it's not worth it to you and doing something else with that hour of sleep is better.
You as a doctor, have you ever treated a patient who has had their health improve once they started getting better sleep?
That's a good question. I can't think of looking at somebody's blood pressure and stuff and seeing that one intervention of sleep made the difference. Most of the time what I see is people just start to take care of themselves in general. Sleep is one of many things that they do, and their health and their blood pressure and all these things get better. Sleep itself, it can. So, adequate sleep, lower risk of heart disease. So somewhere in there, it does directly benefit your health.
What about children? Sometimes I find myself going, hey, get out of bed, man. Like, too much sleep.
Oh,
Get out of
you
bed.
Too
never
much
wake
sleep
a
can
sleeping
be,
child.
well, child or an adult, I'll throw that both out there. But is their thing is too much
wow.
sleep. Like, come on, get up.
Yeah,
Let's
so,
go.
So adequate sleep is still going to put you in that range.
Yeah.
11, 13 hours a night, that's too much. You worry about depression and other, mental problems there.
Wow. I have 7 and 8-year-olds, and I never wake them up when they're sleeping. I figure if he's asleep, it's because he needs it. I'm a little
Sounds fine to me.
softer than Mike might be.
Well,
it
I'm
sounds
not,
like.
7 or 8, but if you're in there for 12 hours, you're getting out.
Okay, all
Time
right.
to go.
Get to work. It's always good to see you.
Yeah.
Oh, go ahead, doctor. You were going to have one last question.
No, I was just going to talk a little bit about sleep hygiene, dark, the ideal temperature,
little bit
65 to
cool.
67, a little bit cool, and then shutting off your mind at the end of the night. A lot of people ruminate,
Yes.
and
Unplug.
that's what keeps
Don't
them.
bring that phone to bed.
Amen.
Exactly.
Absolutely.
Exactly.
I have
Get
one
your
of
phone
those
out of
sleep
bed.
masks that I got at the dollar store. It's worth $1 million.
Perfect.
All right, doctor. Thank you for joining
Thanks,
us.
doctor.